everyone, I'm Dr. Tan Yiping again. Today I'm going to talk about something very touchy and very emotional. This topic has always caused a lot of emotional outbursts in many patients. That is miscarriage and pregnancy loss. Actually, this topic is something that many doctors fear it. Actually, we're very scared to see patients with miscarriage, and we're also very scared to see patients with pregnancy loss. Because why? Because most of these patients usually have a lot of emotions going in them, and we really do not know where they're coming from. Some patients have anger, some patients have guilt, some patients have sadness, and we don't actually know exactly where they're coming from. So sometimes we do not know exactly how to talk to them. And I realize that no matter how we talk to our patients, there's always some patients that we have end up disappointing them or making them unhappy because we may not have touched the right thing about what they want. Like for example, if the patient is angry, but if we talk about sadness, it doesn't work. If the patient is guilty, and then we talk about anger, and then it also doesn't work. So we actually do not know each and every one of our patient what is happening. So that is why it is a very difficult situation that most of us face, and it's not easy to talk to patients like that. First of all, I just want to give a bit of brief introduction about miscarriage and pregnancy loss. There are different types of pregnancy loss, and depending on when it happened, then we call it a different name. So the first 3 months, we call it miscarriage, okay? In the second trimester, we always call the mid-pregnancy losses, and then towards the end is the stillbirth. Whatever it is a loss. It is a loss of a pregnancy which nobody wishes to happen. One thing everyone need to realize is, I always put this as something to most of my patients, is that pregnancy loss is part and parcel of our journey to be a mother. And that is something we have to anticipate to happen before we walk this journey. Many people feel that they walk this journey and they only expect good outcome. But you must understand that pregnancy 9 months, you must understand why is there such a person called obstetrician who does nothing but take care of pregnant women. Why is pregnant women so special that you need one specialty to take care of you? One group of doctors who do nothing but take care of pregnant women. You see, when you look at other fields, every field in this medical world, we usually divide according to the organs. And if you are looking at a pelvic organ, it's a gynecology. But we have such a thing called obstetrics, which do nothing but take care of pregnant women. And there are some ONG specialists who subspecialize in obstetrics only, which means, again, a group of doctors who does nothing but take care of pregnant women. So why do you think that we need such a thing? Because there are a lot of possible complications that can happen in pregnancy, both to the baby and the mother. Okay, because of that, you need just one type of doctor to really take care of this group of women. And why I say that miscarriage is part and parcel of a pregnancy journey is because very often in pregnancy losses like miscarriage, and even mid-trimester losses, and even stillbirths, very often the cause is unknown or known but not preventable. And that is the thing we are dealing with. We are dealing with causes that cannot be controlled. We are dealing with outcomes that we cannot prevent. And because we can't do that in most of the time, and that is why when it happens, doctors are also put in a very difficult situation to face this group of mothers, because there's a lot of anger, there's a lot of guilt, and there's a lot of sadness. It's not easy to handle them, and also their husband, not just them. Sometimes in certain cases, not just them, their husband, but their other family members who will come to our room and demand an answer from us. But very often, trust me, we can't prevent all these things. Why? Okay, let me go through some of the causes, okay? When we talk about miscarriage, there are 3 causes There are three main causes. We divide everything. Actually, if you listen to more and more of my live videos, you realize that I like to put everything into three groups. So, in general, for miscarriage, we divide into three big causes. Three main causes of miscarriage. First is the genetic part. Okay, genetic part where somewhere in the gene is all out. Because in order to produce a healthy baby, you need all the right gene. Not every single egg or every single sperm is good. We are all humans, we are not perfect. Every woman in this world, you may have like 200, 300 eggs, but maybe only, normally we will say, if you are young, maybe 10 to 20% is spoiled. Mutated genes, mutated eggs. We always like to say mutated eggs, or sometimes we know it can be quite nasty. We all say rotten eggs, no rotten eggs, yes. But basically, the eggs are mutated. So why mutated? Because our eggs exist since the day we are born. We are born 300 to 500 eggs the day we are born. But from the day we are born, we do all kinds of things, right? We have air pollution, we take chemicals, we have radiation. Nowadays, this is like normal, you know, having radiation, having chemicals in whatever we eat or we breathe in. So all these things can mutate the genetic structure of the eggs that we have. So can you imagine if the DNA structure of the eggs already mutated and very badly mutated? If it's mutated slightly, you will still be able to have a nice pregnancy for 9 months, but maybe some abnormality in the baby, like some cleft lip or no small abnormality, or even the hole in the heart. But if you have very major mutation, not just a little bit, really a lot, the genetic structure in that particular egg is no longer seen as normal. Okay, so that could be one of the cause, and it not only in egg, can also happen in sperm, although in sperm it's a bit rarer, because what happens in pregnancy is that the sperms all swim up, right? So you only the best sperm reach up there, right? So we presume it's always a good sperm. But in some situation, it can still be due to the sperm if the husband, majority of his sperms are not good. That's why we know now one of the causes of miscarriage is also can be the husband's sperm. If you do a sperm test and majority of his sperm is abnormal, then the wife is also more likely to have. Hi. So miscarriage genetic can be due to the egg or the sperm. The egg is the older we are, the more likely that the egg is going to be mutated. Let's say you are 20 years old, maybe only 10-20% is mutated. But if you're 40 years old, then it's 40-50% mutated. So these mutated eggs can cause miscarriage, can cause abnormal baby. It can cause any problem depending on how badly it's mutated or changed. Okay, so same with sperm. Sperm, it depends on what is the percentage of normal sperm that a man has. If let's say his percentage of normal sperm is a lot, then definitely reach the top one must be good one lah. But let's say your sperm majority is not normal, then there is also a chance that the one that actually fertilized the egg could be an abnormal sperm. So because of this, then you will have more miscarriage. There are also cases whereby that one egg and two sperm, two sperm reach at the same time and got in at the same time. So you see the genetic structure cannot use. You cannot have 3 components of gene inside one baby. So again, it will end up with a miscarriage, and in that kind of miscarriage we usually call a mole or a molar pregnancy, which is also a form of miscarriage. So the first important cause for miscarriage is abnormal gene. And come on, is there any way we as doctors could have prevented the miscarriage? No. So that's why sometimes, because out of anger, out of guilt, a lot of patients actually blame us. Doctor never do anything, that's why I miscarriage. Doctor never do anything, that's why I miscarriage. I went to see the doctor already earlier on, but doctor said baby is okay. And then I ended up miscarriage. Actually, very often, It is not something that is controllable. It's not our control, but patients demand things from doctors. So it's sometimes very difficult. As I said earlier on, miscarriage is a very touchy topic, and it's also a very difficult case to handle. I never liked it, but honestly, I see it a lot recently. That is why I decided to put it up. I see a lot of MCO babies. I also see a lot of MCO miscarriage. As the more pregnancies you have, you also see more miscarriage. Okay, that is the first cause. The first cause, we can't do anything. Okay, we get it right. We can't do anything. So that's why there are certain women, especially those older women. Sometimes older women, maybe they are late 30s or early 40s, they come and ask me, Doctor, can I get pregnant at this age? Then my answer will always be the same. Can, but if miscarriage, don't cry. Because you see, if you're 40, your chances of miscarriage is 40%. What's the chance of you getting a miscarriage? It's so high, you know. It's like there is a very high chance you will get it. You don't cry. If you can get a miscarriage and don't get angry, don't cry, and don't feel guilt, go ahead, get pregnant. Like for me, I got miscarriage, I move on. I didn't feel any anger. I got no anger. I got no guilt. Okay, and I don't feel sad because I know miscarriage is part and parcel of my journey as a woman, as a woman who wants to be a mother. Okay, if you want to be mother, you better be ready to face miscarriage. All right? Okay, and many of you have joined in, but as usual, you are free to ask any question along the way. Okay, don't need to be shy. Try and ask as many questions as you want regarding pregnancy loss and miscarriage. Okay, the second group of cases is due to women's health. Yes, now this is due to women's health. Okay, women's health means something wrong with the women's health that causes it. It can be something to do with the uterus, like you have adenomyosis, adenomyoma, you have fibroid, you have growth within your uterus. Then of course your chances of having a miscarriage is higher. And number two are the women with illnesses like diabetes, thyroid problem, and one very common cause of multiple miscarriage, we will call, only for multiple, not for those one-time miscarriage. But these women usually have like 3, 5, 10 miscarriages. No, I used to see back in government service, some of these women, they just keep on getting pregnant and they keep on getting miscarriages. So one of it is the commonest cause is what do you call that? The antiphospholipid syndrome. Okay, antiphospholipid syndrome, to make it simple, it is actually because of the blood in the woman's body being thicker and clot easily. So because it clots easily, then it forms clots in the placenta, then nothing can go through anymore, right? Then the baby dies off. So that's why people with antiphospholipid syndrome usually have a lot of miscarriages, 5, 10, 20, you name it. Then there's another group, which is rhesus negative women, also the same. Rhesus negative women also have a lot of miscarriages. So if your blood is rhesus negative, I mean in the past to correct that. Nowadays we have prevention for it, but in the past actually some rhesus negative women just have many miscarriages. Okay, alright, so but it's preventable nowadays. Rhesus negative, you're supposed to take all your jabs, then you'll be fine, but just in case somebody forgot to give you the jab. Okay, alright, then other than mother's health, so mother's health, that is antiphospholipid syndrome, rhesus negative, even thalassemia major, thalassemia, not say major, alpha thalassemia, if husband and wife are both alpha, they also have higher risk of miscarriages, but not 100%. But they also have higher risk. Diabetic also higher risk. So you see about alpha thalassemia, diabetic, and also thyroid, they get more miscarriages, but it's not definitely all. And in between, they have some okay baby here and there. But antiphospholipid syndrome is all miscarriage. Rhesus negative, typically, first baby, they're okay. Second onwards, there's a problem. So if the first pregnancy is not done properly, not given the right injections, then the rest of the pregnancy, they will end up with rhesus negative miscarriages. So that is the second component. So I repeat again, first component is genetic, and this genetic is either age related or due to the sperm problem. So this is number one. Number two, and it's totally not preventable, okay? We cannot prevent miscarriages or pregnancy loss from the first reason. Second reason is due to health of the mother. In most instances, it's preventable if you know it. So ask you all, how many of you actually go and make sure they have no diabetes, no thyroid, no thalassemia before you get pregnant, and you're not rhesus negative before you get pregnant? You see, majority of women just get pregnant, you know. They don't even do a blood test before they get pregnant to make sure they're healthy. So, and then how many of you actually scan your uterus to see whether you have whatever fibroids or adenomyosis or whatever? You don't, you just get pregnant. So some of it is preventable and some of it may not, okay? Because adenomyosis very often we are caught in a dead end because treatment is also not really an option, okay? Because a treatment for adenomyosis means you cannot get pregnant, so you have to choose between a high possibility of miscarriage or not getting pregnant, okay? All right, so let's go to the third group. The third group of pregnancy loss is actually all up to the mother's mental stress. So you see, when you go and you follow more and more of my you will realize that many things in a women's health is not just everything physical, it can also be mental. Why? Because of anxiety and fear, worry, fear. That's why some women when I see them, especially in the early pregnancy, and I can see it, I can sense they are worrying. You know how to identify women who are worried and not worried? One of the things, of course, some women are very scared the moment I see them. You can see when they say, oh, pregnant how you know, that type of reaction. Or I've also seen women that the moment they are pregnant, they just tremble in front of me, they're so scared, why am I pregnant? Okay, that's one. But the other one are the over-worried women. Over-worried, you know, because they come and see me, first time pregnant, and they have like 20 questions. I mean, you have 3 questions, 4 questions, that's fine, that's normal. But when you have 10 and 20 questions, you're over-worrying. Over-worried and fear, anxiety is very important when it comes to pregnancy loss. It does affect because of what? One simple reason. Whenever a person is scared, what do you realize? When you want to picture a person that's scared, if you're going to draw a painting of a person that's scared, what are you going to draw? You're going to paint, let's say you're going to paint. You're going to paint the person pale. Because whenever anybody give you a shock, you suddenly turn pale. What is pale? Pale means all the blood vessels will constrict. All the blood vessels will close down and clamp down, and so you look so white when you're scared. So if you're nicely Googling, that's why I don't like Google. Actually, I wasn't say I don't like. I like Google, you like Google. But I don't like Google when my pregnant mothers are Googling. Why? Because there are a lot of people who like to put bad stories inside Google. Then when you read Google, and then you read some, oh my God, something bad happened to this couple, this mother, and what is going to happen when you actually read all this? Some of you, not all, some people are okay. They read, they take it superficially, they know it's going to be rare, it's not going to happen to them. No, but some women who tend to be easily scared anxious type of people, the moment they read that, that moment you can see the face can be pale, turn pale. So which means that all your blood vessels clamp. And what do you think will happen when your blood vessels clamp? When your blood vessels clamp, means every blood vessel also clamp. If every blood vessel also clamp, then how is oxygen going to reach your baby? Right? How is oxygen going to reach your baby if you are scared? That's why very many cases I've seen mothers who had one baby already but had bad obstetric outcome. That means the birth was horrible, traumatic birth, post-delivery depression. After that, you will see 2-3 miscarriages. it will keep on miscarriaging. Because these mothers, the moment they pregnant the next time, they fear. They fear the birth they have to face. That's why I always tell people who have birth trauma, you need to see the therapist. But many of them also don't want to see. They say, I'm okay. Yes, over the next few months, you'll be okay. But when you're pregnant again, you won't be okay. So if you have bad pregnancy experiences, it doesn't have to be labor. It can be during pregnancy, it can be during birth, it can be after birth. If you have bad experiences that cause you to, have nightmares for weeks and months, I think you need to see a therapist before even you think about getting pregnant again. That's one situation. There are some mothers who are not even pregnant before, already the same. I have some mothers who fear birth so much. They fear birth so much. You can see them the moment they are pregnant, they just sit in my clinic like that, shaking. Oh dear, I'm pregnant. Doctor, really I'm pregnant? See? So if you fear birth so much, you have to go and see therapists. If not, they just end up miscarriage after miscarriage. And that is also another problem. Because when you have one miscarriage, let's say, like for me, I have a miscarriage. I had miscarriage in my third pregnancy. I was okay. I don't remember myself even being sad at all. A little bit disappointed, but not really sad or angry or even guilty or anything. And I accepted it as it is. I didn't even take leave from my miscarriage. I continue working. Life goes on as usual. Just ignore it and let it be. Okay. So, but not most women. Most women, whenever they come and see a doctor and when they know it's miscarriage, they demand an explanation. If the doctor can give them a good explanation that they can accept, that's fine. But once the doctor cannot give a good explanation, many of them go back with anger and guilt and they cannot get over it. And when they cannot get over it, what is going to happen? Because the next pregnancy, the moment they're pregnant, they're very scared. What are they scared? They're scared of another miscarriage. They're scared of another miscarriage because that's something they cannot face. That is why I said right from the beginning, and I've said it many times, miscarriage is something you need to be prepared to face if you wish to be a mother. It's part and parcel of a motherhood journey. Because many reasons for miscarriage are totally not preventable. We can't avoid it, we can't prevent it. We need to face it. No doctor in this world can avoid all the miscarriages. Some, yes, not all. As I told you, 3 groups. First group cannot be prevented. Second group, yes, most of it can be prevented, but also not all. Third group, which is what is in your mind, that one, how to prevent if you do not take the first step to prevent it. So that is totally out of our control as a doctor to control what you think. So if you're the type that's very anxious and very worried during pregnancy, one good advice, don't look at the Google, don't join mommy groups. Don't look at places that people are going to share bad stories with you. Only join groups that only receive good stories. Trust me, all the mommy group cannot join. Because the mommy group normally will share some bad stories. Whenever somebody get it, they just share. Please don't, okay? Alright, so these are the 3 main causes. So, which one can be prevented and which one cannot? So the first one I told you cannot be prevented, right? The first one cannot be prevented. Other than, yes, get married early, you're supposed to be married at 20, not 30. You're supposed to complete your family like latest by 30 plus and not by 40. Okay, don't get pregnant when you're older, okay? Number 1. Number 2 is also sperm. There's nothing we can do, okay? The only thing we can prevent miscarriage is to make sure you get married early. But of course, nowadays, there's a positive side to this. Okay, with IVF, that can be prevented in the sense When we do IVF, we can always do PGD. PGD means we test the genetic structure of the egg and the sperm after it's fertilized, before put it into your body. Alright? So we make sure it's normal before we put inside your body. That is totally possible, provided they can find a normal one. So there are some women I notice, I have a few already like that, not many, a handful or so. They already have multiple miscarriages, so somebody will have suggested to them to go and do IVF. And true enough, because we know IVF, we can detect the abnormal pregnancies. So they went and do IVF, and guess what? When they do IVF, all abnormal, then the doctor who did the PGD for them also told them, whichever one you're going to take is going to end up with miscarriage. What's the point? Just give out and throw away. Okay, so in a way, yes, we can prevent. Okay, but you may be lucky, you know, when you go and do IVF and you actually have a normal one, and you think that, then you are on the safe side, lor. If the reason for your miscarriage is purely due to genetic. Okay, and some mothers, because they go for IVF, they think this time they'll be okay. So that can also settle the stress and the fear that they fear, because now we are in control. We are in control. They always think that, oh, at least this pregnancy I'm in control. We know that the genetic structure of the baby is good, so I do not need to worry about miscarriage. So because of that, then fine. They feel they're in control, they have no fear. Definitely the pregnancy will be successful. Okay, the second group is the mother's illness, and that definitely can can be prevented, lor. If you're diabetic, you have to eat diabetic medicine, you have to control your sugar before you're pregnant. If you're thyroid, you need to take thyroid medicine before you get pregnant. You know, if you are rhesus negative, your first pregnancy and all the subsequent pregnancy, you must take all the injections that's required. If not, then we couldn't prevent because rhesus negative, once you didn't take those injections that are required, there's nothing we can do after that to reverse the whole situation. Antiphospholipid is also totally preventable by medication, although not everyone can solve by simple tablets. Some may need to be on injections, but it's definitely preventable. And last of all, the uterus. Yeah, the uterus, if you have fibroid, you have adenomyoma, all this all can be removed by surgery before you get pregnant, so that you do not have a miscarriage. Of course, in adenomyosis can be a bit tricky, because in adenomyosis, we will can't totally treat it unless you actually have a removal of uterus, which is not really a solution because you want to get pregnant. But most of it is preventable. So you see, actually it's preventable. And if you have fear, you're the one that's very anxious, always very worried when you're pregnant, please go and settle it before you get pregnant in the first place. The best is settle it before you get pregnant in the first place. So don't go through a miscarriage and after that see the therapist. Honestly, when I get the feedbacks from the therapist, they always say the more miscarriage you have, the more difficult their job, because they have to go through each and every miscarriage and pregnancy loss with you to settle one after another. It's like 1 score, 2 score, 3 score. You really have a lot of things to get over with. But if you go after before your miscarriage, will be better. Let's say you know your first pregnancy is very traumatic and you're very scared to get pregnant again, then go and see the therapist straight. Okay, if you don't know where to see a therapist that specializes in women's health, I have it in my clinic. Okay, you can always make an appointment to see my therapist by WhatsApp 012-322-9820. I repeat, if you need my therapist service, 012-322-9820. Okay, you just WhatsApp and you say you want to get an appointment to see my therapist. Okay, I'm not saying that my therapist is the best therapist in the world, but the only difference is my therapists see only women's health. They see women every day and they only see women's health, gynae related problems. So of course they are a lot more specialized in handling cases of pregnancy loss. Okay, but please come early. If you come after 3 miscarriage, 4 miscarriage, we will still see you, but it's not going to be easy because we have to bring you through so many. But I have many cases, even with 3-4 pregnancies, we have been able to help them get through the I would say their darker part of their journey and bring them up to light, enlighten them, and after that give them hope, and then only we embark in the pregnancy journey. That's why people with miscarriage, when they come and see me, I say you see my therapist first. Not those with one, but maybe you have 3, 4 miscarriages. When you come and see me, I always say you see my therapist first. After you see my therapist and my therapist say you're fine, then only we talk about how else to prevent a miscarriage. Because if you can't get through your heart, there's nothing I as a doctor can do for you, okay? Because medicine can only bring you that far. Medicine are not miracles. So when we want miracles, we have to settle everybody from every aspect, okay? We need to settle your heart and your mind, all right? Okay, now I'm going to question section. Okay, quite a number of questions came in along the way. Shahinas asked, Doctor, mostly you see miscarriage happen at how many months? By definition, miscarriage is supposed to happen in the first 3 months. So you know the first month, so people do not know that they are pregnant. So by the second month, when you first know that you're pregnant, most of us will not be able to determine whether a miscarriage is going to happen or not. So it's somewhere in the middle of the second month onwards to the 3rd month. That is when most of us will be able to detect miscarriage. Okay. Pregnancies after the 3rd month is very unlikely to end up with any form of pregnancy loss. I'm not saying can, but very unlikely, because the chances is less than 1% already. But the first 3 months, you know, it can go up to 30-40%, so the chances is higher. That is why everybody say after 3 months pregnancy is stable. Actually, it's not that after 3 months is stable. Most things happen within the 3 months. After that, things should be quite okay. Complications are less. Fu Joey asks, does pregnancy help prevent miscarriage? It helps in 2 ways. The first way it helps is, number 1, in Antiphospholipid Syndrome, we use aspirin. That is the way to treat Antiphospholipid Syndrome. Yes, but you will find that in majority of women with miscarriage, if we do a test for Antiphospholipid Syndrome, they are negative. So, aspirin is not supposed to prevent the miscarriage, but aspirin is again something we tell mothers that we are doing something this time. So it's again what we do with your mind. Because if you are going to miscarriage because of the genetic structure that's abnormal, aspirin is not going to do anything. But it can prevent if you have Antiphospholipid Syndrome. But if your miscarriage is going to happen again because you fear miscarriage, aspirin helps because it gives you a sense of security that this time you are in control and you're doing something to prevent your miscarriage. So yes, aspirin is like wonder drug. Many doctors use it even if we know that you don't have antiphospholipid, because it seems to work. It seems to work, but if you actually go and study and all the research done, no, it's not supposed to work. It works because we give you the sense of security. Su En Lau asks, is it easier to get pregnant after miscarriage? There's no difference, but how would I say? There's actually no difference in getting pregnant after miscarriage, but sometimes those people who have a bit more difficulty in getting pregnant in the first place, sometimes all you need is to just get pregnant one time to give yourself confidence that you can conceive again. Okay, so that gives you the confidence. So it's again a psychological effect rather than a physical one. So, but it's good. That is why we know infertility, in miscarriage, therapies are very important because they mold the way you think. Okay. Okay. Chiling asks, does cholesterol cause miscarriage? No, antiphospholipid is not nothing to do with cholesterol. Okay. Chris Angeline asks, I had a miscarriage 2 months ago. Doctor said I had blighted ovum, but did not explain further. May I know what it is and the cause? Okay. I had a natural miscarriage when it is advisable to get pregnant again. Alright, so blighted ovum is due to the first reason, genetic structure of the egg or the sperm. So it's not preventable at all. So if your miscarriage is a natural miscarriage, you can get pregnant after 2 to 3 months. Alright? Okay. Yes, thalassemia check is very important. Ellie Yin asks, hi doctor, would like to ask, Will radiation emitted by electronics such as phones cause genetic abnormality of the ovum and sperm? I won't be surprised it does, but nobody knows, and nobody can avoid your phone nowadays, right? So nobody knows, because whatever that happens through the years. It's not today I use the phone and then my eggs get or today I stop using phone and it doesn't happen. No, it's happened over the years. And it's not just the phone and your electronic, even your sun. I know previously we have hardly any ozone. I heard good news with COVID-19, our ozone has built up, so we are less likely to get radiation from the sun. But in the past, even our ozone couldn't prevent us from the sun, and also a lot of electrical cables, microwave. There's just so much radiation around us nowadays. I don't think we can ever prevent that. Okay, so generally, please marry young, which is another problem nowadays, because women are marrying late, and not only marrying late, they expose themselves to more radiation before they get married. So there's more miscarriage. So I told you, miscarriage is part and parcel of your journey. So accept it as part and parcel of your journey. Caused by food you eat only if you're diabetic. Because if you're diabetic, then sugar makes you miscarriage. Not pineapple and papaya. I take lots of pineapple during pregnancy. But we usually say that there is a small component in pineapple that has small effect. But that's provided you eat a lot lah. It's so small. Component is not going to cause any harm. But if you're going to eat a lot of pineapples, maybe. Papaya, never heard of. But generally, we have no issues with fruits except when you are diabetic. Diabetic patients, diabetic women in pregnancy for miscarriage, we are not talking about full-blown diabetes. We even talk about borderline diabetes. If you're borderline diabetes or you have hereditary diabetes, your parents got diabetes, all these fruits is going to have your chance of miscarriage high. Going to happen because of all these fruits is because they are sweet. Okay, because they're sweet. So taking a cup of Milo is equally bad. Alright, or a cup of teh tarik is equally bad. Alright. So Tovi Zaina asked how to get rid of those worries when I've experienced miscarriage before. As I said, look for professional help. There is people who deal with mental health. So psychologists or therapists or counselors that deal with women's health, they are good at doing all their work. Leave it to them. Find one, seek one, and get them to help you. They are really good at it. I'm very amazed by how they work. As I say, my clinic, we have a team of them, and they're really doing a good job. Okay. After all of them, all my patients who went to see them, they're able to let go. They have accepted that baby is gone, and they accepted everything that has happened to them. That's very important. I think religious teachers also help sometimes, I hope. It very much depends on you, because I have 2 mothers so far who have recurrent miscarriages. When they went to therapy, they actually scolded God badly. So, I mean, if you're going to scold God, then probably religious teachers not the way to go. But some people who can accept what God has planned for them, then probably religious teachers can also help. Okay, so very individual depending on your how you view religion as such. Musa says she's very sad because both trauma, most are in denial and they accept it as norm. Yes, they accept it as norm, but if it's going to affect them having miscarriage in the future, then they should seek therapy. Okay, because birth trauma is a very big topic and it's not so easy to deal. I have written a lot of articles, posting on Facebook on birth trauma. Sometimes it's a very big topic. I have seen many, and it's not easy to deal with. It's still the underlying problem. It's not really the trauma, so they need therapy help. They need help from mental health professionals. Okay, so not see psychiatrists for medication. No medication is required when you have recurrent miscarriage, or you have over worrying, you have fear, you have anxiety. All you need is to see a therapist or counselors that talk to you through it. Okay. The people who are trained and professionally trained to do this type of work, they know exactly what to do. Jane said that first pregnancy was super smooth. This time around is quite challenging. Can't avoid being a little bit more stressed. I hope you have gone over your stress, and I wish the best for you, GN. Yep. Hafiza, you'll be repeating a lot of things that I wrote. Miscarriage is part and parcel of motherhood journey. That is one thing every woman need to understand before they embark into this journey. Miss Zeng Miao thank Dr. Tan. I very happy met you when I pregnant again after miscarriage 2 times. Now my baby is 29 weeks and healthy baby. Thank you very much for letting me know, Miss Zeng. Yes, I have many. In fact, I have many. Miscarriages to me is very easy to deal. You deal with them mentally, then you deal with them physically. So once you deal with them mentally, you put them on all the medications that's required, then most of the time is successful, more than 90% of the time, even for recurrent miscarriages. Then Su An Lau Tan asks, is it safe to get pregnant at the age of 36? As I told earlier many times, if you want to get pregnant at the age of 36, you must be prepared to face miscarriages and abnormal baby. If you can face it, go ahead. It's safe, there's no problem. You just need to be able to face it. Okay? Any way to improve ovum and sperm? No, you need to be married younger. That's the only way. So if you are no longer younger, you just have to face it. You have to face it. No choice. Be prepared to face it. Okay? You can get pregnant again and again and again until you get it right. Okay? Be prepared to face it. Because there are a lot of things we do in our life is like that, right? We do something, we don't get it, we fall down. Like a baby, try to walk, cannot walk, fall down. And then keep getting up, try to walk, cannot walk, fall down. Eventually still can walk. So pregnancy journey is like that. If you want to get a miscarriage, just let it be. Go on with it. Try again and again and again, you get it. As long as you make sure you don't have those the second one. Because the second one you can't do anything. Second one is preventable. When you have illnesses, then you don't just keep trying because you keep giving you miscarriages. That one is totally preventable. Third one, if you are very stressed, very worried, and very fearful of being pregnant, then you have to go and seek therapy, lor. Then preventable, lor. You can prevent, lor. Those ovum and sperm thing, you just keep trying, you get it one. Okay, because not all eggs are spoiled and not all sperm are spoiled. But of course, you can always still go and to IVF, okay? Okay, Musa say thank you. You're most welcome. Very enlightening talk. Even though I never experienced miscarriage myself, I know friends who have gone through miscarriage and stillbirth. It can be devastating. It is good to be aware that in most cases it is unpredictable and unpreventable. Too much blaming on the mothers. Yeah. So you need to understand that because there are a lot of things going on. They have anger. They have a lot of time, anger as well as guilt. In many mothers, whenever they have miscarriage, there is something deep inside them that tells them that it could be their mistake. They tend to blame themselves. That is a very natural thing to happen. And because they blame themselves, they can actually be angry with themselves. That's why when they're angry with themselves, they can throw their anger on us as doctors as well, which we truly understand. That's why I say these kind of situations are very touchy and very difficult to handle at times. But you must remember that out of the 3 reasons that I mentioned just now, nothing to do with something that you would have done or not done. So even if you go climb mountain, jumping, it's not going to cause miscarriage. Or what you eat, what you drink, it's not going to cause miscarriage, you know. So don't worry. Alright, Miss Siti Mariam asks, I had experienced 3rd time in a row miscarriage after my 3rd child was born. Until now, I tried to conceive but did not. My period also on time every month. No period pain. Is there any possible causes that I don't know yet? No. The 2 causes that you already have 3 children, so I don't. Okay, go back to 1, 2, 3. Okay, if your age is catching up, genetic causes could still be a problem. Number 2, illnesses that could develop over the years like diabetes, thyroid problem, you still need to go and check and make sure your uterus have no fibroids and things like that. And 3rd, it could still be due to your stress or your past bad experiences. Now you have 3 miscarriages, you already have 3 bad experiences. So bad experiences can cause miscarriage. Sometimes I realize I see many cases like that. The very first miscarriage actually is due to the genetic abnormality like blighted ovum, like Molar Pregnancy. But because of their bad experience the first time and they couldn't accept the miscarriage, subsequently all the rest of the miscarriage are all due to fear only. Because some of the mothers, they cannot accept it. I told them, let's do a test. This time miscarriage, I'm going to take the baby and go and test it genetically to prove to the mother that you're genetically normal or not. So when they see it's normal, they know. When you see it's normal, we also know. It's all due to your fear. And you have to settle your fear. Go for therapists, counselors, psychologists to settle it, okay? Chrissy asked, my first pregnancy is smooth, second pregnancy I miscarriage at 8 weeks. Is it because of ovum or fetus not healthy? It can be due to any of the 3 reasons, okay? Can be due to any of the 3 reasons I mentioned earlier. Adinda Yusrina asked, 6-week pregnancy having yellow discharge. No itchy, no smell, or flagell, and mostly. Can sembuh tak, doctor? I think the way to go about with discharge is to first, you need to know what is the cause of discharge. So if you're taking so many medication, I feel like you're covering every single bacteria you have in your body to try and get rid of your discharge. But I think that's not the way to it. Normally, I will do a swab test first. I want to know exactly what causes the discharge before we determine what is the right medicine to treat you. Can sembuh? If we can sembuh or not, then depends on what is the cause, okay? Depends on what is the cause. Alright, Roslan, hi. I experienced pregnancy loss 5 times. Out of the 5, 2 times is ectopic. Both the ectopic occurred after I took a triggered shot of Vidrel. What do you think about this? Or would you like to share some advice? Okay, now you have 5 and 2 of it is ectopic. Ectopic is a different story altogether, but of course, many of the hormones that we deal with, Ovidrel is a hormone. Many hormones that we take can actually cause ectopic because it causes the disturbance of the timing of when the implantation and everything comes. But it may not be the main reason as well, because the fact that you take Ovidrel, I presume you have some amount of fertility issue, and fertility issue can also cause ectopic, okay? Endometriosis and pelvic inflammatory disease are the 2 common causes of fertility difficulty in getting pregnant. At the same time, also causes ectopic pregnancy, okay? And you also have 3 times of miscarriages, all your stresses that you're going through. I can expect why you have a miscarriage. I have one case that I've shared last year, it finally given birth end of last year, which is exactly the same, have multiple miscarriages and multiple ectopics, and then she finally decided to do IVF, and her IVF is getting more and more stressful. Each time she do IVF, finally I told her, dear, please, you need to see my therapist. See my therapist, get her out of it. And finally, she gave birth. Finally gave birth. And guess what? She's in her 40s. 44 years old. Finally, she got her first baby. We need to get you out. So if you need help, please call my staff for an appointment. Alright? Remember my number 012-322-9820. 012-322-9820. Because I am the very, very few gynecologists that provide mental health help as well. Okay? We really need to get you out. Hi, Eileen Lau. I have 3 times miscarriage in 2nd trimester. My doctor told me that I have incompetent cervix, so I have my cerclage done in my 2nd and 3rd trimester, but still fail, but doesn't work. I presume you didn't have a cervical, you had a cervical cerclage. Okay. When we feel cervical cerclage, then you need an abdominal cerclage. Okay, that is what you need to do. That is something you need to do before you're pregnant, and be prepared to do a cesarean. So abdominal cerclage is something we do laparoscopically before you're pregnant, and then abdominal cerclage has a higher chances of success compared to cervical cerclage. Why? It's quite simple. This is your cervix, okay? This is your cervix, yeah. Cervix, we can actually tie at the root or tie at the end. So when we do cervical cerclage, by the time we wait until the 4th month to do your cerclage, most of the time, this part already open. Because the cervix open from here onwards, from the uterus, it open from the inner part onwards. Most of the time, this part already open. And then to stitch from below, we also can't go too deep. We are also very scared that if I go too deep, I may actually stitch into your membranes and others cause leaking. So we always stitch where we are comfortable, which is actually further away. It's not so secure. So for abdominal cerclage, we stitch at the very, very in root of the cervix, which is definitely a lot more effective. Okay. Genetic screening can check for abnormality in genetic. What if the result is negative? Sorry, genetic screening is when you check your blood. You want to do a genetic screening for miscarriages, you don't check your blood. you check the egg or the sperm. So nobody can check egg and sperm unless you do your IVF, okay? But I did mention some of the cases just to prove to people that their miscarriage is not, because some people they got so many miscarriages. I tell them it's all due to their fear now, but they cannot accept it. So I say, okay, let's take your baby. I mean, when your baby is passed out, I will test your baby this time. And very often, the babies when I send for testing is totally normal. That genetic testing can be done to the thing that passes out during miscarriage. Okay, we have to take the baby component of the placenta that comes out, and then we send for genetic testing, and then we can know whether the genetic testing is negative or positive. If your genetic testing for your miscarried baby is normal, then your miscarriage is either due to reason number 2 or 3. So reason number 2, most of people will just need to go for all the blood tests and scan their uterus, and if they're not, then your reason for miscarriage is number 3, okay, which is a psychological reason. ESR cause miscarriage? No. No. Punching? No. Your ESR and platelet count does not cause miscarriage directly, unless you have some autoimmune disease that cause your ESR and platelet to go up, like SLE, rheumatoid arthritis. All these are medical problems. They are all these medical problems are linked to, associated with antiphospholipid syndrome, which I mentioned earlier, and that will cause miscarriage. Christine Uchat asked why baby's heartbeat can stop, why it can happen. Same, the reason is all the same. All 3 reasons I mentioned earlier. First is if it's due to genetic abnormality, the heartbeat will stop because this baby is abnormal. The baby will have an abnormal heart at one point. The heart cannot survive anymore. The heart will stop. Okay. Number 2, it's not necessarily just abnormal heart. It can be abnormal brain, abnormal liver, abnormal some important organ. You must understand we have certain important organ that has to be normal in order to survive. No humans can survive without brain, without heart, without a liver. So if these things are, but babies, they can survive without liver because the placenta does the liver job, but you need a good brain and good heart. So if your good brain and good heart is not good, is totally spoiled, totally abnormal, cannot use, then the baby will die, okay? Number 2 is due to medical problem. So as I said earlier, medical problem, any of those medical problems I mentioned earlier, diabetes, thyroid, all can cause problems for a baby's heartbeat to stop. And last of all, fear, worry, which I mentioned just now, because when you're scared and you're worried, your blood vessels all clamp down, no blood goes to the baby, and the baby dies. So these are the reasons of why the heartbeat can stop. All 3 reasons, okay? Yes, Nur Faiza Izati. Yes, thrombophilia screening got to do with your antiphospholipid syndrome. So antiphospholipid syndrome is one of the reasons that cause many miscarriages. So when antiphospholipid, they can have all miscarriages on 3, 5, 10, whatever you have. I've seen more than 10 even. So, but this is very easy to test, just a blood test to do everything and to find out whether you have antiphospholipid syndrome. And once you have antiphospholipid syndrome, then the miscarriage is totally preventable with the right medication. Okay, Tracy Lim asked, can influenza jab, chickenpox jab cause blighted ovum? No. What about antibiotic? No. No. Blighted ovum is due to genetic, okay, which I mentioned earlier. Because in blighted ovum, the pregnancy is alive but without a baby. So something in the formation of baby went wrong. And the only reason you could have that is due to genetic reason. There's a theory that the body can produce new eggs. What is your thoughts? As far as theory is theory, but what we know is everyone is born with a certain number of cells. They may not form eggs, okay? When you scan a person, there's nobody with 300 or 500 eggs that you can see on the ovary. But those, we have the cells at a we have the number of cells that are going to form eggs that are predetermined at birth, okay? Of course, they will produce as new eggs as you go along, but the cells are already there the day you are born. So, Shamini Samuel, hi Dr. Tan, hi Shamini Samuel. Last year I thought I lost my baby. After that I tried to conceive, but my menses every 35 days. So I checked fertility clinic, only egg size not increased 18 mm. there is also a situation about miscarriages that I noticed. A lot of people after one miscarriage have a lot of difficulty trying to conceive again. And they have a lot of problem with their menstrual problem. And one of the reasons why their menses is disturbed after a miscarriage, some people will say maybe the last doctor didn't do properly, or maybe the D&C done previously was not done properly. But actually it's not, okay? It's because mentally you have not accepted the miscarriage and you have not moved on. So mental stress will cause your period to be abnormal. Mental stress can cause you to be difficult in getting pregnant. I have so many these type of cases. They get married, they got pregnant, and then got miscarriage, and then after that for 5 years no baby. Why? The first pregnancy came so easily. It's all up here because you cannot accept your miscarriage, and therefore you cannot get pregnant after that. So please, after every miscarriage, every woman must go and see therapists, okay? Molar pregnancy. Hi, Suen. Suen asked about molar pregnancy. Molar pregnancy, I just now explained. 2 sperm, 1 egg. So sorry, I can't help you. Okay, 2 sperm reach at the same time, fertilize the egg at the same time. Everything is normal, but we know pregnancy can survive with 3 sets of DNA. Okay, you cannot have 2 fathers with 1 mother. Okay, so no, that's how you have molar pregnancy. So, can you have healthy pregnancy the next time after molar? Definitely lah. Next time, takkan like every time 2 sperm reach at the same time. Where got so lucky, right? These type of things don't happen every day. Okay? Ida Ugu asks, okay, with my husband, I don't have any discharge problem. I have 2 miscarriage last year. Smell is usually due to certain infection. I think you better get checked. Alright, Sarah had a colleague who had several miscarriages, and she mentioned that there are several ways of removing the fetus. Yes. Yeah. So just to explain to you, there are 3 methods of removing the pregnancy. So a lot of people conventionally, whenever they have miscarriage, they will go and do a D&C. But actually, you all need to know you have 3 options. 3 options. What are the 3 options? You see, all my talks are 3 options. I always put out 3 fingers. No, it's always 3 options. Okay, this is also well documented in a lot of guidelines. The first is natural miscarriage. Means I don't do anything. I just wait. Is it possible? Yes. Every pregnancy that is not viable will eventually come out. So if you wait long enough, all pregnancy will come out. But it's not suitable. Is it suitable for everyone? No. It's suitable for everyone, provided you are not the anxious type. Why? Because miscarriage come, number 1, I have to warn you, it is like labor, it's like childbirth, you have to go through the pain. Are you able to go through the pain calmly at home? Because natural miscarriage most likely going to happen at home, because we don't know when it's going to happen, right? So you're going to have miscarriage pain at home, labor pain at home. Can you deal with it? If you can, yes. Number 2 is you're going to see a lot of bleeding. Are you going to get worried? Are you going to get panic? Whether you, your husband, your family members in the house, your mother-in-law, everybody, if they're the panicky type, you're not suitable for natural miscarriage, okay? If you're going to panic, don't. Because it's always going to happen in the middle of the night. You rush to the hospital, and trust me, you won't get to see a specialist. No specialist going to see miscarriage at 3 a.m., okay? So you wouldn't want that to happen, and you get more worried because no specialist is seeing you. You're just seeing a normal medical officer, and you're not really happy. So outcome will not be so good, then you get traumatized. What's the point, right? So no. Don't opt for natural miscarriage if you're not that type of mother. I had one patient that is very steady. She really scanned and she know that no heartbeat. I already told her this is going to be miscarriage. She have 3 options, and then she said she want to wait for natural miscarriage. Then next question she asked me, Doctor, next week I'm going to Bali for holiday. Can ah? I said if you are damn cool and calm, go ahead lah. Nothing's going to happen to you. No, that's what she did. She went to Bali. She miscarried in Bali. She didn't see any doctor. She fly back. And then she get this scan. And these type of mothers definitely can go for natural miscarriage. Okay, so cool and calm can still go for holiday. Okay, second option is a D&C, which a lot of people hear, the chuchi, the cleaning of the uterus, or suction and curettage, which is the right thing that we are doing nowadays, which is S&C, no longer D&C. That is a slightly older method where we suck everything out lor. Okay, this is a procedure, it's a surgery, you need to go under anesthesia. And of course, being a procedure, all procedure has its risk associated to it. So if you're going to do just one D&C in your entire lifetime, I think it's fine. But some people ended up 2 and 3 times. Like recently, I had one mother who actually has been my mother in her first pregnancy, but subsequently she had multiple miscarriage, which I was not aware, and she saw other doctor, and other doctor keep doing a D&C for her. So after her third D&C, then she had some complications. Yes, usually it's the third one. So if you're going to have multiple miscarriage, don't go and do D&C. So you go for, if you think you are not suitable for natural miscarriage and you don't want to go for D&C, what is the third option? There's always a third option. Third option is induction. No? You see, you have natural birth, you have cesarean birth, you have induction. So I can use the same induction medicine for you to have a miscarriage, just like a natural miscarriage, but now you are induced. This is suitable for people who want natural induction but worry that they will be scared, or they will worry that they can't face the pain, because these are inductions. Usually I would do it in the hospital where everything is under control. So some people, they prefer to be under control, and in fact this is the preferred mode of miscarriage by most of my mothers, except during MCO. During MCO, everybody is opting for natural miscarriage. Okay, nobody is going to hospital during MCO. Okay, will polyp cause miscarriage? No, polyp don't cause miscarriage. Polyp cause bleeding. It causes bleeding during pregnancy, and when the bleeding, you get worried. And when you get worried, you get miscarriage. Okay, that's how it goes. Polyp does not cause miscarriage. Cindy Hin asks, is second pregnancy higher chance of getting miscarriage? No. Every pregnancy is equal chance. And why would it be more higher chance? It's unless your first pregnancy is a traumatic one, or you have a very big gap. That means you're a lot more older than your first pregnancy now. Then yes. Chi Ling asks, I have 2 fibroids. Is there anything I need to do before? No need. It's so small. Just go and get pregnant. So small, unlikely to cause miscarriage. Okay. Mahazato Munisa asks about recurrent miscarriage, which is what I mentioned earlier. Some women are not so lucky. They actually have miscarriage multiple times. Okay, Ismail asks if PCOS cause miscarriage. PCOS is linked to diabetes. If you saw my previous video on PCOS diabetes, and diabetes is linked to more miscarriage. Yes. Okay. Eileen Lau asks whether I do cerclage laparoscopically. Yes, the answer is yes, Eileen. Oh, right, I finished all your questions. Oh dear, it's more than an hour already. Alright, my videos are getting longer and longer. So, okay, this Sunday I'm having another video again. Oh yeah, I'm going to talk about birth. Breech or bleed transfers, come what may. Okay, there are a lot of mothers that worry the baby doesn't go into the right position. But even if the baby doesn't go into the right position, does it mean you need to have a Caesar? And how to solve it, I'm going to explain this Sunday. Alright? Okay, thank you for watching my video again. Thank you very much, and please share with your friends if you find this useful. Thank you, bye-bye.